because we're finding more breast cancers with early detection. The treatment of breast cancer has evolved. Over the last 50 years, we've come from being very radical to a more conservative approach because we are detecting it so much earlier. As far as causes of breast cancer goes, nobody really knows what specific things cause breast cancer, but there are some risk factors that increase the risk of breast cancer. Some risk factors we as women have no control, and some risk factors we do have control over to lower the risk of breast cancer. The ones we have no control over is being a woman itself. By itself increases the risk of having breast cancer. Men rarely get breast cancer. The age, a family history increases your risk of having breast cancer. But surprisingly, only 5 or 10% of breast cancers are hereditary. The age women started having their first period, age they went through menopause. Earlier they start their period and the later they have menopause, that increases their risk of having breast cancer. The not having any children increases the risk of breast cancer. Having children at an older age, after 30, increases the risk of breast cancer. There's also a condition called atypical ductal hyperplasia, which you find sometimes on breast biopsies. That increases the risk of breast cancer. The things that women have control over is, of course, weight. Obese women are at a higher risk of having breast cancer. Even overweight women are at a higher risk of having breast cancer. Breastfeeding lowers the risk of breast cancer. Having children, as I mentioned earlier, before the age of 30 improves their risk. Alcohol increases the risk of breast cancer. 2 or more glasses of wine a day increases the risk of breast cancer. And exercise lowers the risk of breast cancer.